For more on Secretary of War Hegseth and the questions about those Caribbean boat strikes, let's bring in Congresswoman Mariannette Miller-Meeks. She's a member of the House Veterans Affairs Committee. So it sounds like the President and the Secretary of War are preparing to release the video of the two strikes on that alleged drug boat. Are you satisfied, or will you be satisfied if that video is released?
Well, I certainly think the video helps with transparency, but I think we need to remember, number one, that we had an administration, 4 years of a Biden administration, that did nothing as both Venezuelan gangs and gangs throughout Mexico came across our border, untold number of drugs. And so Trinidad, Aragua, other gangs that were bringing drugs in the United States, record numbers of overdoses of young people. And so, yes, as designating them as terrorists, this was a military strike. We've seen this before. We saw this under the Obama administration, where there were drone strikes that were carried out on individuals. And I don't remember this level of vitriol coming from the traditional media about these. I recall even under the Biden administration, after the disastrous, incompetent withdrawal from Afghanistan that cost 13 young service members their lives, that the Biden administration launched a drone strike on a convoy that they thought was a Taliban, and it turned out to be a UN convoy, killing individuals and children.
Right.
And I don't recall the level of concern over that strike. So these are narco terrorists. There is actionable intelligence, multiple agencies, multiple intelligence agencies that determined that this was a threat, and a strike was performed. So I think given the information that we had, that it was verifiable, and I think the appropriate action was taken.
There's a headline in Axios yesterday I wanted to read for you. It reads, Democrats on the House Armed Services Committee are pressing Secretary of Defense Pete Hegseth to release video of U.S. military strikes on an alleged Venezuelan drug boat that have inflamed tensions on Capitol Hill. Do you think those tensions are, artificial in some respects, or are Democrats really that hot about this issue?
Well, again, we heard nothing when record numbers of people were coming across our southern border, record amounts of drugs. You had 15% of the illegal drugs in the United States apprehended at ports of entry, but that's 85% that were not apprehended at ports of entry. Numerous gang members of every type of gang in Mexico and in South America and in Venezuela coming across their country, 107,000 Americans between 18 and 45 dying of drug overdoses. And I don't recall them being concerned about the cartels having the interactions they did at our southern border. I was down at the southern border when the cartels sent drones over into the U.S. airspace to track what we were doing and what Customs and Border Protection was doing. I don't recall hearing any of them concerned about what happened. I don't recall them calling out the Biden administration for the disastrous, incompetent withdrawal from Afghanistan, the fact that we can't conduct over the horizon counterterrorism, so we had no eyes on Iran, China, or Russia, and the fact that they took out a UN convoy. I was concerned in 2012 and 2014 with Obama, and I recall talking to a newspaper in my district about Obama carrying out drone strikes, killing an American citizen with no actionable intelligence, no proof that this person was a terrorist. So that, and then you have, 6 members of Congress asking, U.S. military members to not obey illegal orders without defining if there was an illegal order. So creating dissent, sowing doubt among our military. So I find it just a little bit more anti-Trump than I do true concern over what's happening.
Let's talk very quickly about affordability and prices. We have a graphic that shows price increases under the second Trump administration as compared with the Biden administration. Under Biden, overall inflation went up 4.3% in the first year, his first year in office, 1.6% for Trump. The numbers are significantly higher for the Biden years, and especially when you look at new and used cars, they were up almost 14% under Biden. They're actually down about half a percentage point under President Trump. I know that health care is a big issue for you as a physician. Do you think that Republicans are going to be able to come up with a way to either eliminate Obamacare or replace it with something that actually works and saves Americans money?
Well, first and foremost, we want healthcare costs to come down for everyone. We want to lower healthcare costs for every individual. And I think most of us who were working through what was happening when the Unaffordable Care Act was passed back in 2010, we're very concerned about the level of consolidation and the fact that the promises made by President Obama were not going to materialize. And remember, it was President Obama who said, if you like your health care plan, you can keep it. Millions lost their health insurance. If you like your doctor, you can keep them. I had to have patients leave me and go to another provider. It was going to bend the cost curve down. Very importantly, we had to pass Obamacare without even reading it because it was going to bend the cost curve down and you were going to save $2,500 per year on your premiums. That has never materialized. Costs have continued to skyrocket. Subsidies are going directly to very profitable insurance companies. And I think what's important for people to realize, we know that in the Biden administration that we had cumulative inflation over 20%. In 2022 alone, it went up to 9%. Those are government figures. We're still trying to work out through that, work out from under that, and lower prices for everyone. That includes food, and fuel, electricity, and especially it includes healthcare costs. And we have done things on that. Our reform for pharmacy benefit managers, or PBM reform, is going to help bring prescription drug costs down. The work we are doing on lower cost, greater transparency, the work we have done on direct primary care and the working families tax cut, and also allowing for HSAs, or health savings or health reimbursement accounts, for those on bronze plans. So we are actively working to try to bring down healthcare costs for everyone, not just people on the exchanges, but employer-based insurance, small businesses insurance, and those who are self-insured.
Americans would welcome that opportunity. Let's see if it comes to fruition. Congresswoman Mariannette Miller-Meeks, thank you.
Hey, it's Will Kane. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Kane podcast for full episodes right now.